Identify the correct entry point at the tip of the greater trochanter. Accurate entry point selection is essential to ensure proper nail alignment and minimize the risk of malreduction. Assemble the main sleeve together with the guide wire sleeve. Position the assembly over the entry point and advance the threaded guide wire. Introduce the awl over the guide wire to create the initial cortical opening. Advance the reamer carefully over the guide wire until adequate entry has been established for nail insertion. Remove the initial guide wire and introduce the bowl-tip guide wire using the reducer. Sequential reaming of the medullary canal using the flexible reamer shaft and the appropriate reamer attachment. Assemble the nail with the insertion handle and firmly tighten the conical bolt to establish a rigid connection between the implant and the targeting assembly. Position the assembled nail and carefully introduce it into the prepared entry portal. Use the hammer attachment to apply gentle, controlled impaction. Attach the proximal aiming device to the insertion handle. Protection sleeve, drill sleeve, and trochee. Position the sleeve assembly against the lateral cortex and measure the depth. Sequential reaming with the help of short and long reamer. Insert the bone tap for the compression blade. Use the locking pin screwdriver to engage and lock the blade and screw assembly. Insert the compression blade through the targeting assembly and advance it carefully into the femoral head. Select a compression screw that is 5 mm shorter than the compression blade and insert through the corresponding guide. Advance the screw until it fully engages the compression blade, creating a stable integrated construct. Attach the lock screw to the targeting assembly. Attach the outrigger to the insertion handle, followed by the distal aiming bar. Ensure that all connections are fully tightened before proceeding to distal locking. Connect the stabilization device to the distal targeting assembly. This provides additional rigidity during the locking procedure. Insert the drill sleeve until it contacts the lateral cortex. Drill through both cortices using the appropriate drill bit. Measure the required screw length using the depth gauge. Then select the appropriate 4.9 mm interlocking screw. Once satisfactory implant positioning has been verified, loosen and remove the distal targeting assembly. Carefully detach the stabilization device, distal targeter, and distal aiming bar while maintaining the stability of the implanted nail. Select the appropriate end cap based on the final implant configuration. For short nail procedures requiring dynamic distal locking, select the appropriate aiming arm according to the implanted nail length. Use the aiming arm designed for the 200mm nail or the aiming arm designed for the 240mm nail as indicated. The complete instrumentation set is organized to support an efficient surgical workflow. Each instrument is clearly designed for a specific stage of the procedure, helping to simplify implant preparation and insertion.